I had spent 5 years as a night nurse and certainly had the experience of driving home and cutting across multiple lanes and not realizing I had done that. And so that, along with listening to our nurses here in our annual satisfaction survey, taught me we have to do more about night shift nurses' wellness, and we wanted to start with fatigue.
Hi, everyone, and welcome to the New Jersey Nursing Insights podcast. I'm Sue Weaver, and with me is my co-host, Daria Wazek.
We're your new hosts from the New Jersey Collaborating Center for Nursing, and we're excited to get right to it. The state of healthcare right now is tough. That nursing shortage we're all living through, it definitely does not spark joy.
Exactly. And we can stew in that for a while, but we can't live there forever. So on this podcast, we're going to hear from nurses who are finding ways to change things for the better. Which brings us to today's topic, nurse fatigue. We all know the research recommends napping, but making it happen seems impossible. And this is personal for me. I once did a qualitative systematic review examining the experiences of night shift nurses. And I was really horrified about the stories of drowsy driving. Nurses falling asleep at red lights, or what was even more shocking to me, nurses waking up at the light when the person behind them got out of their car and banged on their window, waking them up. Or nurses not even knowing how they got home. It really has become obvious that we need to address nurse fatigue. And one of the ways is implementing sanctioned napping.
And today, we have two guests who made it a reality. We're so excited to talk with Dr. Pamela Hinds and Brett Bagshaw. Pam, could you introduce yourself?
Oh, I'd be happy to, and thank you so much for featuring fatigue on the night shift for nursing staff. So, Pam Hinds, and I am a nurse scientist at Children's National Hospital, a professor of pediatrics at the George Washington University, and also the Research Integrity Officer for Children's National Hospital.
Thank you. And Brett, could you do the same?
Yes, thank you for having us. My name's Brett Bagshaw. I've been a nurse for about 30 years. I work at Children's National with Dr. Hinds. I'm a crisis nurse, so I help out with all of the craziness wherever it may be in the hospital. I'm in direct patient care. I work throughout the hospital on all the different units.
Wonderful. So let's get started. I shared what sparked my interest in this topic of nurse fatigue. So tell us, Pam, what prompted your interest in nurse fatigue and the implementation of napping?
I actually started by studying the fatigue with children with cancer, and it was pronounced and interfered with all daily activities. And while I was studying children and their fatigue, nursing staff said to me, "Sometime study us." And they got me into the literature. Plus, I had spent 5 years as a night nurse and certainly had the experience of driving home and cutting across multiple lanes and not realizing I had done that. And so that, along with listening to our nurses here in our annual satisfaction survey, taught me we have to do more about night shift nurses' wellness, and we wanted to start with fatigue.
So you could really relate to those drowsy driving.
Indeed, I could.
So I've really read and reread your article entitled Going Beyond Position Statements, One Hospital's Successful Initiative to Implement Napping for Night Shift Nurses. And that was published in the Journal of Workplace Health and Safety. And I think it's a fantastic roadmap. Can you talk about the early implementation?
Indeed, I can. We actually started by finding out if we might have a very brave director of an inpatient unit who was willing to do a demonstration project about fatigue. Having found that person, Rose Ellis, and that was inpatient oncology and hematology, we then formed a team to actually look into the literature, it was amazing what we found and what we didn't find. We certainly found 17 studies, most of which had to do with truck drivers, pilots, but not healthcare professionals. And the very limited number of studies for healthcare professionals were very small sample, pretty much about an initiative that was tried on one unit. And what we picked up on was that no matter what was tried, there were people who benefited. And part of the benefit was, of course, feeling more restful. But the other benefit was feeling a part of a team. So then we went back to creating this demonstration project on one unit. We just wanted to prove in one unit that we could implement safe napping with guidelines and that there would not be problems. Consistently, as we went through that 1-year pilot demonstration, we kept all of nursing leadership informed about what we were doing, and we invited human resources in more as a conversation to know what we were doing during that year. And the year went really well. No complaints, no problems, and we did not step in to monitor closely. Instead, we left this completely in the hands of leadership on the night shift on that unit to know which nights could include napping for the nurses and which nights could not because of patient acuity, staffing concerns. Partway through that demonstration project, the RN said we'd really like to include all members of the nursing care team, and we believe we can fit all of us in on those nights where napping is possible. So a very successful 1-year demonstration, and that became the basis then for forming the broader team that Brett was a part of. And that team had mostly night shift nurses on it and a wonderful colleague, sleep expert from industry, and that was Jean Geiger-Brown. Could not have had a more committed partner in this entire process.
Well, that's great. So thank you for sharing that. And Dr. Geiger-Brown is a leader in this research. And she's the one that even published about some of the resistance in other studies she's done from nurse leaders, that you couldn't get the napping implemented because nurse leaders were very reluctant. So that's my $1 million question. How did you get support from the higher ups to implement this napping?
I think Brett and I can both answer that. We scheduled us to have ongoing meetings with nursing leadership just to let them know where we stood as a project team. We asked to be on different agenda so that we no surprises by the time we got to the end. We didn't want to take people by surprise by suddenly asking leaders to support a new and unfamiliar initiative that they did not feel well apprised about. So everything that we did, the literature review, how we weighted the goodness or not of every article that we studied, the national guidelines that we looked at from the Institute of Medicine, from NIOSH, from the American Nurses Association, all of that literature we took back to our nursing leadership and HR and kept asking to be on their list of important topics. Brett can speak to taking it to the leadership of our shared governance because that's a very strong group here at Children's National. And Brett was our point person for that. Brett?
Well, I think, as Dr. Hinds mentioned, the team that we formed was a huge part of our success, the translation team, which included, nurse scientists such as Dr. Hinds and Dr. Geiger-Brown, but also I'm not sure how many, but many of us, bedside nurses. So it was a very comprehensive group. And yes, from, the beginning, we did all of the different steps, but we did have a couple of us go. We went to our Shared Nursing Leadership Collaborative Forum, and we presented all of our findings from our literature review and also the survey. We haven't spoken about that yet, but we did survey night shift nurses and had some very telling data. that really helped our case.
Mm-hmm. Oh, am I glad you mentioned that, Brett? Key point. We had about 165 nurses on the night shift complete a survey for us about had they ever experienced any of the following. And it included falling asleep at a stop sign on the way home, falling asleep while giving report, not remembering the report that you gave, and multiple other examples. And the findings were genuinely concerning to all of us. You can't have findings like that and not pay attention to them, not feel responsible for making our nurses safer, whether it's during the night or going home. And if we make our nurses safer, we make our patients safer. And that's what we were really wanting to demonstrate, was that we could make things better by implementing napping. So through Brett's effort, we then had wider appeal beyond a single unit. And at the end of that demonstration project, we prepared our final summary of all of our findings and brought it back to the entire leadership group, managers, directors, CNO, and also included HR. And at the end of what we had found, we made recommendations and we offered to be responsible for implementing napping across all of our inpatient units. So we had 2 slides in our PowerPoint that said you could charge us to do the following. And we listed all the steps that we would take and be responsible for as a work group if our nursing leadership and HR wanted to implement inpatient napping on the night shift. And they charged us accordingly with every one of those steps. And one of those steps was to develop a toolkit. I think that was one of the most fun, Brett, when we created that toolkit based on all of our evidence. But one of the messages that I think Brett spoke most clearly about to the nursing staff was safety. And I could speak to, we're going to find you a safe place to nap. We worked with security in order to do that. We worked with EVS to have clean linens for our nurses to use. But it was really Brett's message to the staff about coming prepared. Brett, do you want to speak to that?
Sure. That was a big part of it for the staff to understand that, yes, this is a wonderful addition to our plans for our night shift, but that you can't come to work tired and expect to get a nap, that you come to work well rested and prepared and assume that you're not going to get a nap and then hope that you do. And, we try to protect that time and protect each other. But yes, just know that the nap is not guaranteed. But as Pam was mentioning, part of the struggle was finding those safe, clean spaces. And we did, several of us, the team, walked around the whole entire hospital, really scoping out safe sleeping places for the staff.
I can very much appreciate that some settings would not want to do this. And I think if Brett and I were blunt with you, we would say that there's a specialty unit that we have here, small, and typically there's one RN on at nighttime. And so to ask that RN to nap would potentially be difficult for that unit. And in fact, the RNs who staff that unit preferred not to do it. And we really respected that. To be more honest, we had one director of nursing who wanted to go along with everyone, but did not feel good about having nurses napping. And this director tried very hard to look at the literature with us, had several meetings with us, and it took a little over 2 years for that director to say, all right, we'll give it a try. And I think what helped was, of course, all the steps we had taken, yes, but there was some peer pressure from other directors saying, this works. We have nurses giving better report. We have nurses going home feeling more alert. You should try it. And of course, staff were talking to each other about trying it and what they liked and what they didn't like. And the nurses on this director's unit really wanted a chance to be a part of it. So I think that helped us. But we also benefited from an increasing awareness, broadly speaking, about healthcare professionals' wellness. And several of our units created respite rooms for staff. And the rooms had what we would say would be relaxing chairs. And you could go in and take your break there. And I think that helped to call out the need and maybe the responsibility of healthcare settings to pay attention to what can we do in our environments to help our staff on the night shift be their absolute best. And Brett and I would tell you, we think napping is one thing that hospitals can do. It's not the only thing, but it clearly is one thing that works very well for a proportion of night shift workers. And when we look at our surveys, it's not every nurse who wants to nap, but of the nurses who tried napping, which was less than 50%, 47% said they were safer and felt better on the shift and better going home.
It definitely is a mindset that you need to help people adopt. A lot of nurses, I mean, I wouldn't call myself a napper. I never have taken naps before in my life, except maybe when I was a baby. But, so to try to convince people, yes, it works. Yes, it's safe. Yes, you're protected. Your job is protected. This is an approved initiative. And as Dr. Hinds mentioned, that toolkit that we provided had very specific guidelines as to how the napping should take place. All the units had to have a designated area. So you can't find a quiet, dark patient room that's not being used and take a nap. You have to sign off to someone and make sure someone's covering your patients. All of those kinds of things. So when you explain those steps to people, I think that sort of made them feel better to know that if I follow these guidelines, I'm completely protected. It's, a tried and true thing that can help keep everyone safe.
Was there a policy in place before making it difficult, like saying there was no sleeping on the job, opposed this new approach?
Indeed, there was, and we really wanted to work with that. The policy was if you were found napping, falling asleep, napping on the job, you are eligible then to be fired. This was well known across the institution, and so when we started, people openly asked, will I be safe? Will my job be safe? Or am I at risk? In working with HR, we asked for a policy revision after we had the very successful implementation. We wanted staff to feel safe. In part, we then also promised that we, as a study team, would not be coming in and taking attendance about who, for example, chose to nap. We did not want to have that kind of a heavy hand involved. We wanted to make the point that we trusted nursing judgment, and if the judgment of the shift leaders was that they could nap that night, that then was to be settled amongst the nurses. We gave some recommendations for prioritizing who could nap and who would have to wait and see if the entire shift could support more napping. Not every shift supported anyone napping, and once in a while, everyone was eligible for napping and could take that time. But it was a night-by-night basis for that. As Brett referred to with our toolkit, in the toolkit, we talked about sleep hygiene and what each of us needed to do in coming to protect ourselves. And that was information that I certainly wished I had had when I was working nights, and was so grateful now to find that information published in the literature. So we've included that in the work that we did leading up to napping, in the toolkit, and that we have reiterated since then. We will mention a little bit later, perhaps, a subsequent study in which sleep hygiene figured prominently for the 2 intervention arms that we used. We do believe that sleep hygiene is critical for nurses and any other night shift worker to keep in mind to protect their health. We often make jokes about night owl, morning lark. But in truth, each do have biorhythms that align with being a morning lark or a night owl. And the biorhythms, circadian rhythms, are far fewer for the night owl. So not many of us are meant to work the night shift. Most of us are morning larks. So we have to change our circadian rhythm and biorhythms in order to be effective on the night shift. And that's part of what we talk about with sleep hygiene.
And were there any other challenges that you would like to mention as far as implementation? You have mentioned a lot and described sort of the steps that you took. What about securing adequate space? How did that look?
Well, I think, like I was mentioning, we did have to seek out the actual space, and that just took a search throughout the hospital. I'm sure you all know our hospital is like any other. It's in a constant state of construction, redoing different units. So it actually is continuously evolving. And some units, had areas that were better than others. The emergency room was one area that proved to be very difficult to find space. And then there's so many different layers of it too. Just finding the space was the first step, but then you need to find somewhere comfortable to sit or lay. So, some units purchased chairs. The CICU, for example, thought it was a great idea to get air mattresses. So the staff would, blow up an air mattress and lay down, and then they'd be napping, and the next person would come in the room and have to blow up the air mattress. So that didn't work very well. So it was, different trials of different things. And then there's, keeping the space clean, the linen people might use, EVS having to clean the space, and safety for the people who are napping. Is it in a space that's safe? There are some areas of the hospital that are quite remote. They're nice and quiet, which is great for napping, but maybe also somewhere someone wouldn't want to be alone sleeping at night.
Agreed. We had a fun moment. In looking for space, I was down in the emergency room looking for space and found 2 rooms very nicely labeled overnight. And I asked if they were in use, and I was told by a good colleague of mine, a physician, "Oh no, we don't use them. We think that anyone who sleeps at night is a wimp, and we don't want to be wimps." And I said, "Oh, may I have them then? I'd like those 2 rooms." And he said, "Well, sure, you can have them, but why are you asking?" And of course, then I shared the initiative, and he said, "Oh, I should be keeping those 2 rooms." And he did. So on we went to find more space. But the point, of course, being the responsibility to look, to find, and to try to protect, yes, the room, the space, but more importantly, the sleeper. And that's why we worked with security so closely. We chose areas that had a camera outside in the hallway so that the security could be monitoring who was walking anywhere near these rooms, and did they need to have a person patrolling those rooms. And we really appreciated their willingness to do that for us.
So it's so great to hear all your expertise and wisdom on this implementation of napping. And I agree, real estate in hospitals is tough, and we may want to introduce these sanctioned nappings, but finding spaces is very important. And your toolkit, I think that's vital. And if other nurses want information on your toolkit, can they send you an email or?
Oh, that's a great, yes, Sue. Thank you for thinking of that. We'd be so pleased to share that toolkit. We'd be so pleased. Mm-hmm.
Can you share any stories from nurses about their experience napping? I know from my reading on this that, napping really helps with that reduction of end-of-shift fatigue.
I know personally when I work nights, I love being able to take a 20, 30-minute nap. It makes a huge difference for me personally. And as a crisis nurse, I mentioned my job. I do walk around the whole hospital all day long, all night long, and have the chance to talk to other nurses across all the units, and really have heard great things about napping, how much people appreciate it. I actually last week was at Villanova for a job fair and spoke to some, seniors. And a couple of them did say, oh, I heard Children's has napping. So I, talked to them about our napping program. And it was just wonderful to hear, because I think in general, there's such a push towards wellness, and to hear these young people who could work anywhere and have thought that that is something that's going to be very important. No one wants to work nights. And they first asked, if I come work at Children's, am I going to have to work nights? And I said, well, yes, probably. But they said, but I heard you have night shift napping. And that was exciting to be able to share that with them.
I was sharing with Brett that when I do a midnight nursing research rounds, of course, that's night shift, I was so excited because after we implemented napping, gosh, Brett, I can't even remember, but maybe a year afterwards, I was in one unit and introducing myself to a nurse who I'd not met. And she said, I came here to this hospital. I was working across town. I want to work nights, but I want to be at a hospital that cares for its employees that work nights. And I heard that Children's National has napping. And I thought, oh, that's a hospital that cares about its night shift workers. And I was thrilled. So that happened to me another night. Similar story, nurse having come from another setting, looking for a caring employer. And I'm awfully glad that nurses on the night shift, and certainly any employee on the night shift, would recognize that this was done as a caring effort to support their wellness. That is a message well received and well intentioned.
Yeah, that's great examples. Yes, I agree with you 100%. I have another question for you, and I hear this from other nurse leaders throughout the country. They say the nurses on night shift don't even take their regular breaks. I had one nurse say to me, I've been working 20 years and I've never taken a break. Anyways, so the leaders say to me, if they're not taking breaks, why would I implement napping?
We understand those concerns. We, too, have people who are not comfortable taking a break. There's a number of reasons, but it is a culture, and it's a culture that we have to grapple with. We know that there can be a subtle message given that if you take a break, then you're not able to withstand the rigors of the job and that you've got to be tougher. We actually don't support that. We want people to take a break. And if they choose to nap, we want to be supportive of that use of the break. We would share with you then the most recent study that we have done on night shift wellness. Those nurses who took breaks had the best improvement in scores for sleep quality, compassion fatigue, and professional quality of life. We want nurses to have those improved scores, and we want them, therefore, to take their breaks.
When you implemented napping, was it for all shifts or just for night shift nurses?
Oh, it's a fair question, Sue. It was only for the night shift. And I can say we've had day shift staff say, when are you going to implement that on the day shift? We have not. And I suspect that finding space for the day shift would be even harder than it was on the night shift. So no, we have not done it yet for days. I think there's reasons to ask, but I think the priority has been for night shift with the morning larks who are working as trying to be night owls and trying to change their body biology versus those who are working day shift and have a more natural match as morning larks with daytime hours.
But I think that our napping initiative has been sort of the impetus for many wellness things to come. I mean, we started this many years ago, but since we started night shift napping, we have developed a shared nursing leadership night shift council. We have a new Pam, I always forget Jill's title, wellness director. I sort of maybe selfishly see napping as the start of lots of wellness at Children's. But I do think day shift can join in and many other wellness initiatives. But napping has been a big part of many other things that have come along too.
Yeah, I think nurse fatigue is across shifts. And I think the literature shows that, nurses are fatigued on day shift. When you look at their hours too, they're probably get up at 5 in the morning to get ready for work, to get to work by 7. And nobody gets out at 7 or 7:30, do they? Well, rarely. But you're right. There's more to this story, right, Daria?
Yeah, that's a great segue for my next question. Just thinking of the larger wellness picture, what is the sleep hygiene recommendations with regard to eating versus napping? Do you pick one? Can you do both?
So we have scheduled it so you can do both. However, there is a recent publication coming out of NIH which is suggesting taking great care about eating on the night shift if you're working the night shift. Now, it's one study. It's relatively small, but it's raising a cautionary note. Now, what's in contrast to that, of course, is the sense of community that nurses enjoy having a few moments to eat together if they take the break. I was looking at some of the data we have from nurses who talk about standing up, eating their food at the nurse's station so that they can hear all lights, see all lights, hear all bells for their patients, and the great concern they have for not being readily available to patients. Again, we don't know the strength of the science about eating on the night shift or what to eat on the night shift. It's a very important nutrition question that we think we should study in the near future.
And then I like to always ask, well, what's available on night shift for those working nights? Many hospitals have lots of vending machines, and you know what those contain. The sugar-sweetened beverages, candy, healthy things. It seems like we've got a lot of work to do.
It's a good point you make. Yes, definitely. We have been, since we've had this night shift council, part of our shared nursing leadership, I feel like we have really started to pay a lot more attention to our night shift nurses in regards to, as you say, nutrition, even, meetings, mandatory meetings that all happen to be scheduled during the day. Now we're scheduling some, more geared towards night shift. We do have a small cafe that's open 24 hours a day. Yes.
What advice, Pam and Brett, would you give another hospital who's thinking about implementing a napping program?
I think for us, the winning point was not to start big, but to start small and to do that demonstration project. Each hospital, and within each hospital, each inpatient unit has its own culture, has different personalities, and it's the choice to do it that makes the difference. And if people feel in any way at all that this is not the right time for them, or that people will question their judgment by trying it, then that would be too difficult, a bridge too far for them to go for. But if there is a demonstration unit that has everything going for it like we had, with a very creative, courageous nursing leader, and very interested staff willing to follow self-care guidance and other forms of guidelines, such as from the toolkit, that's the perfect place to do the demonstration project. It doesn't have to be all units at the same time. It really can be getting more evidence that could be more credible for the others to look at.
And I think that the toolkit was definitely a very important part, but also, as you said, Dr. Hinds, the fact that each unit still had their own independence, I guess, to do things the way they wanted to. So they had the guidelines, which those had to be followed pretty strictly. But then beyond that, we weren't micromanaging how each unit did it, because each unit was their own separate. They had their own issues, their own needs.
I really liked your mention, Brett, about night councils. I think that's really important because nurses working nights have unique issues and need a forum to address those issues. And even something simple, and I'm not always advocating for education, but I think nurses before they start nights need some education, because I remember a new nurse at our hospital having a car accident on the way home from work, and she considers herself a night owl. and never had an issue. And she didn't, after working 2 night shifts, she found herself facing oncoming traffic. And her recommendation was, if I only knew, if I only had some education about that. So I think you're right that there's more to this than just, you can't quickly implement napping. You have to do your due diligence before you implement. Consider education. Do you have night councils? There's so much more to implement with that.
Well, we're in a unique position as nurses, as healthcare providers. We take care of other people and we need to take care of ourselves. So the research we've done, the napping initiative we've implemented, is to take care of ourselves. And my son actually is a new college grad and is working the night shift. He isn't a healthcare worker. He actually works for Amazon and works nights. But I've been able to share what I've learned from our night shift napping program. They don't get to nap there, but, other pieces of it about sleep hygiene and driving and things like that I think have helped him get through his night shifts and home in a safe way.
On our podcast, we actually have a tradition at the end of our episode asking our guests to explain, how do you engage in self-care? So this was a great segue. We're talking about self-care a lot today, but how do you take care of yourselves?
Oh, I have so many ways. Brett's more admirable than I am. But I would say I actually love walking. I love reading and I love baking. So all of those are amongst my favorites. And they give me true pleasure. So I think that's what self-care is looking for what makes you smile. And those 3 do it for me.
For me, I would say, the fresh air, being outside, running is my passion. And I was with my friends this morning. It's friends and running, the combination of those 2. And I was telling them about this podcast this morning, and they all knew. They were like, "You're going to do great. You're good now. You've gone for your run. You've cleared your head." So.
You did do great.
And excellent advice for other hospitals thinking about implementing new programs, especially when it comes to napping. Your advice, Pam, start small, frame it for safety, and build momentum. This is fantastic, actionable advice. Pam and Brett, thank you so much for sharing your journey with us. It's truly inspiring work. To all the nurses and nurse leaders listening, the evidence is clear. It's time to move beyond just talking about fatigue and start implementing evidence-based solutions that protect our nurses and our patients. Join us next time for another important conversation. Until then, stay safe.